To Focused on Health and the latest on coronavirus as it spreads worldwide. The to-do list is long but necessary as hospitals and health departments around the country prepare for potential coronavirus patients. The University of Mississippi Medical Center says it is ready. The CDC alerted UMMC as well as medical facilities across the country in early January to be aware of patients with respiratory complaints who had traveled to China. Handling those who come to the emergency room requires a quick response.
The screening tool is the very first question we ask them when they present through the door and enter our institution. So once we get their name, if we even get that, we are automatically asking them, have you traveled outside the United States in the past 30 days? Have you had contact with anyone who has traveled? If they answer one of those two questions in the positive, we then look at their signs and symptoms to see if they do fit the criteria for this particular respiratory illness. If they do trigger that, they automatically get a screen prompting them to move the patient immediately to an isolation room after they put a mask on them. So minimizing the exposure to the waiting area or any other possible healthcare individuals or other patients that are currently being seen within the emergency department.
And while there have been no confirmed cases of coronavirus in Mississippi so far, after a trip to South Korea this month, University of Southern Mississippi choir students as well as faculty and staff that traveled with them are concerned. The Mississippi State Department of Health has been in touch with USM's Health Center.
There's no recommendations for those individuals to isolate. The recommendations are for those individuals to self-monitor.
The students visited South Korea prior to Monday's Level 3 travel advisory. The CDC and the Department of Health says the students are at a low risk to get the virus. The school is advising the students to not only self-monitor for 14 days, but to self-isolate as well.